Greetings to our respected lecturer, Dr. Warren King, and also for fellow friends. We are from Group 1, and today we will be presenting our topic entitled Tuberculosis for the course GTJ228, Microbiology, Parasitology, and also Immunology. So here's our group member here. My name is Bunkiat, and we have Ain Shahira, Balkis, Elisa, and also Wahida. So for our presentation today, we'll mainly cover about the causes of transmission of tuberculosis, clinical manifestation and diagnosis, treatment and nursing management, and finally, a clinical case study on pulmonary tuberculosis. But before we begin, here are the learning objectives for today's presentation. By the end of this presentation, the audience should be able to explain the causes and transmission of tuberculosis, understand the signs and symptoms, diagnostic investigation, and also the treatments of tuberculosis. Apply appropriate nursing management and infection controls measures for tuberculosis patient. Analyze a clinical case scenario related to pulmonary tuberculosis and its management. So we hope this presentation will provide a clearer understanding regarding to the importance of early detection, proper treatment, and holistic care in nursing tuberculosis management.
Tuberculosis is one of the major infectious diseases in the world and is still a health problem in Malaysia. Around 10 million people develop TB and about 1.5 million people die from it globally every year. TB spread through the air when an infected person coughs, sneezes, or speaks. Nurses play an important role in controlling TB through early detection, health education, and infection control.
So for my part, I will explain the pathogen overview and laboratory diagnosis of tuberculosis or TB. So tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. So bacterium mainly attack the lung, but it also can spread to other organs such as kidney, spine, and also brain. So TB can spread through airborne droplet. This is mean when an affected person cough, sneeze, or talk, the bacteria can spread through the air and infect to other people. So humans are the main reservoir for this bacterium. So TB is mainly transmitted from person to person. So now I'm going to explain the characteristic of Mycobacterium tuberculosis. So the first one we have characteristic is acid-fast bacillus. So Mycobacterium tuberculosis possesses a unique waxy cell wall which is rich in mycolic acid. Because this thick layer, the bacteria retain the primary stain, even though after being washed with alcohol during the laboratory procedure. So this is why Ziehl-Neelsen staining, or also known as acid-fast staining, is the standard method using to identify TB under a microscope. So in sputum sample, the bacteria stand out as a bright red or pink rod-shaped bacilli against a blue background. So this waxy wall protects the bacteria from chemical disinfectant, dehydration, and host immune response, which is allowing to survive long-term inside the human body. The second characteristic is its exceptionally slow growth rate. So unlike the most bacteria that multiply rapidly, TB bacteria divide very slowly, which is taking about 15 to 20 hours for a single cell division. So consequently, confirmative culture testing require a long incubation period, which is typically taking 2 to 6 weeks. So this slow metabolic rate also explain why standard TB treatment must be strictly continued for several months to entirely eliminate the pathogen. So additionally, the bacteria can remain dormant and asymptomatic in the body for years, a clinical condition known as latent tuberculosis infection. The last characteristic of Mycobacterium tuberculosis is strict aerobic, which is mean absolutely require oxygen to survive and multiply. So this explains why tuberculosis primarily target the lungs, specifically the upper lobe, where oxygen tension is highest. So when inhaled into oxygen-rich environment, the bacteria multiply, leading to classic pulmonary symptoms such as a persistent cough, chest pain, fever, night sweat, unexplained weight loss, fatigue, and hemoptysis. While it primarily affects the respiratory system, the bacteria also can disseminate through the bloodstream to extrapulmonary site, including kidneys, spine, brain, and lymph node.
Next, I will explain about the pathophysiology of tuberculosis, which describe how the disease develop inside of the body. First is transmission through airborne droplets. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. The disease spread through the air when an infected person with active TB coughs, sneeze, or talk. These tiny droplets containing the bacteria are released into the air and can remain suspended for several hours, especially in crowded or poorly ventilated areas. Second is inhalation. When another person breathes in these infected droplets, the bacteria enter the respiratory tract and travel down into the lungs, particularly reaching the alveoli, which are the tiny air sacs responsible for gas exchange. Third is alveolar macrophage infection. So after the bacteria reach the lung, the immune cells called macrophage try to destroy them. However, the TB bacteria are strong and can survive inside this immune cell instead of being killed. The bacteria then multiply inside the cells and continue the infection process. Fourth is granuloma formation, also known as the latent TB. To prevent the bacteria from spreading, the immune system forms a granuloma, which is a collection of immune cells surrounding the bacteria. So this helps contain the infection and keeps the bacteria in an inactive state. At this stage, the person usually has no symptoms and is not contagious, but the bacteria remain alive inside of the body. Finally, reactivation or active TB occur when the immune systems become weakened due to the factors such as HIV infection. The granuloma breaks down, allowing the bacteria to become active and multiply again. This leads to lung tissue damage and symptoms such as persistent cough, chest pain, fever, fatigue, and weight loss. At this stage, the infected person can spread the TB bacteria to others. In conclusion, tuberculosis develops step by step, starting from the spread of the bacteria through the air, entering the lung, surviving inside the immune cells, forming latent infection, and finally, becoming active when the immune system weakens.
So now I will present about the pathogen characteristic of Mycobacterium tuberculosis, which is the bacterium that causes tuberculosis or TB. First, let us look at the structure of Mycobacterium tuberculosis. This bacterium has a thick and waxy cell wall made out of mycolic acid, peptidoglycan, and arabinogalactane. Inside the bacterium, there are components such as the cytoplasm, ribosome, and DNA or nucleate region. The thick, waxy cell wall is very important because it protects the bacterium and make it more resistant to environmental stress and antibiotic. Now, moving to the first characteristic, which is slow growth. Mycobacterium tuberculosis grow very slowly compared to many other bacteria. Its generation time is around 15 to 20 hours. Because of this slow growth, laboratory diagnosis and treatment monitoring can take a longer time. This is one reason why TB treatment usually requires several months to complete. The second characteristic is acid fastness. The bacterium contains a high amount of lipid, especially mycolic acid, in its cell wall. Due to this waxy layer, it does not stain well using the normal grain stain method. Instead, an acid-fast stain such as Ziehl-Neelsen stain is used. The bacterium retains the carbofuscin stain and resists decolorization, which is why it is called acid-fast. The third characteristic is its oxygen requirement. Mycobacterium tuberculosis is an obligate aerobe, meaning it requires oxygen to survive and grow. Because of this, the bacterium commonly infect areas with high oxygen level, especially the upper lobe of the lung. Next is the cell wall composition. The cell wall has a complex waxy layer that can contain up to 60% lipid. This unique structure gives the bacterium strong resistance against environmental stress, antibiotic, and the host immune defense. This characteristic also contribute to the difficulty in treating tuberculosis. The last characteristic is transmission and survival. Tuberculosis spread through airborne droplet when an affected person cough, sneeze or talk. Other people can inhale this droplet and become infected. Another important feature is that the bacterium can survive and persist inside macrophage phagosome. Macrophages are immune cells that normally destroy microorganisms, but Mycobacterium tuberculosis can avoid destruction and continue surviving inside this cell. In conclusion, Mycobacterium tuberculosis has several unique characteristics such as slow growth, acid fastness, oxygen dependence, a complex waxy cell wall, and the ability to survive inside the immune cell. These characteristics make tuberculosis difficult to diagnose and treat, and they contribute to its spread and pathogenicity.
Now I will explain the clinical manifestations of tuberculosis. So firstly, respiratory symptoms of tuberculosis often appear gradually but can be serious. A persistent cough more than 2 weeks is a key warning sign and sometimes accompanied by blood or sputum. The patient also may experience chest pain due to lung tissue damage. And medical imaging often reveals infiltrates in the lungs. In more severe cases, pus and blood may be present in secretions, reflecting ongoing infection and tissue breakdown. Secondly, systemic symptoms of tuberculosis reflect the body's overall response to infection. Patients often experience a persistent fever and significant night sweats, which signal ongoing inflammation. Sudden weight loss and loss of appetite are common, showing how tuberculosis affects metabolism and nutrition. Fatigue and general weakness further reduce daily functioning, making these systemic signs important clues for early detection and diagnosis. Now I will explain about high-risk group of developing tuberculosis. These include HIV patients whose weakened immunity makes them more exposed to TB infection, and individuals with diabetes mellitus where high blood sugar reduces immune cell function. Other than that, long-term immunosuppressant therapy more than 6 weeks also increase exposure to tuberculosis by weakening the body's defense. Senior citizens over 65 years old face risk due to age-related decline in immunity. And lastly, healthcare workers are exposed through frequent contact with infected patients. Recognizing this high-risk group is crucial for prevention and early intervention.
So now I will explain the laboratory diagnosis for Mycobacterium tuberculosis. So we have 4, which is So for the first laboratory diagnosis method, we have sputum smear microscopy, or also known as AFB stain. So the function of this test is to detect acid-fast bacilli in the patient's sputum sample. So it is widely used because the test is simple, fast and inexpensive. Healthcare worker can quickly identify the patient may have pulmonary TB or not. So one advantage is that result can be obtained on the same day and the test is affordable. However, the limitation is that less sensitive compared to molecular tests, and it cannot detect drug resistant. False negative result may occur if bacterial count is low. The second method is the culture test, which is considered the gold standard for TB diagnosis. So the function of this test is to grow and identify Mycobacterium tuberculosis from the clinical sample such as sputum. So the test is used because it is highly accurate and can confirm TB infection. It also can help detect drug-resistant TB. The advantage is that it is very sensitive and reliable. However, the limitation is it is take longer time to get the result because the bacteria grow very slowly. Sometimes the result may take several weeks. The next test is Gene Expert. So this is a rapid molecular test that detects tuberculosis DNA and rifampicin resistant using PCR technology. So it is used because it can provide fast and accurate result, usually within about 2 hours. So it is have advantage, which is it can detect drug resistant at the same time. However, The limitation is that the test is more expensive and requires special equipment and cartridge. The final diagnostic method is chest X-ray, which is function to identify any abnormalities in the lung, that may suggest the tuberculosis infection lah. And it is commonly used to support tuberculosis diagnosis and assess the severity of lung involvement. So one advantage that is quick and also non-invasive. However, X-ray alone cannot confirm tuberculosis because lung disease may show similar finding. So therefore additional laboratory tests that are still needed.
Now, I will explain how tuberculosis or TB is treated and the steps involved in the path of cure. First is early diagnosis. Early diagnosis is very important to detect TB quickly and start treatment as soon as possible. Doctors usually perform tests such as sputum examination and chest X-ray, also known as CXR. Once TB is confirmed, anti-TB medications such as isoniazid and rifampin are started to control the infection. The second step is the initial phase of treatment, which lasts for about 2 months. During this phase, patients receive intensive HRZE therapy. HRZE is referred to 4 main anti-TB drugs, which is isoniazid, rifampin, pyrazinamide, and entambutal. The purpose of this intensive treatment is to kill most of the bacteria quickly and reduce the spread of infection. Next is the continuation phase, which usually lasts between 4 to 7 months. In this phase, treatment is continuing to eliminate the remaining bacteria that may still survive in the body. Patients commonly continue taking medications such as isoniazid and rifampin either daily or weekly, depend on their treatment plan. The fourth step is directly observed therapy or DOT. In this method, healthcare workers monitor and support patients while they take their medication. This helps ensure the patient follow the treatment correctly and consistently. DOT is important because incomplete treatment can cause treatment failure. DOT is very important because incomplete treatment can cause treatment failure and drug-resistant TB. Another important aspect is resistance prevention. Patients must take the correct drug combination, correct dosage, and complete the full duration of treatment. This helps prevent the development of drug-resistant TB, which is much more difficult to treat. The final step is completion and cure. After completing the treatment, doctor will check whether all the bacteria have been eliminated from the body. If the lungs are clear and no bacteria remain, the patient is considered cured from TB. In conclusion, TB treatment involves several important steps, including early diagnosis, intensive treatment, continuation therapy, patient monitoring, and prevention of drug resistance. Following the treatment plan properly is very important to achieve full recovery and prevent the spread of tuberculosis. Next, I will explain the prevention of tuberculosis or TB. The first prevention method is staying at home. During the first 2 to 3 weeks of treatment, patients with active TB can still spread the bacteria to others. Therefore, they should avoid going to work, school, or crowded public place. Second is home isolation. The infected person should reduce close contact with family members and sleep in a separate room if possible. This helps lower the risk of transmission. Third, patients should wear a face mask when around other people, especially during the early stage of treatment. Wearing a mask helps prevent bacteria from spreading through the air. The fourth prevention step is covering the mouth while coughing or sneezing. A tissue should be used and disposed of properly in a sealed bag to prevent contamination. Lastly, vaccination is also important. Infants are commonly given the BCG vaccine to protect them against severe form of tuberculosis, especially TB affecting the brain and spinal cord. In conclusion, practicing proper preventive measures is very important to reduce the spread of TB and protect public health.
Hi, I'm back. My name is Boonket. So I will continue the presentation with the next part, which is mainly focused on the case study and clinical management of pulmonary tuberculosis, followed by the conclusion. So this case study is adapted from a published report by BMC Infectious Disease and highlights the consequence of delayed treatment and self-medication in tuberculosis patients. So the purpose of this case study is to demonstrate how theoretical knowledge is applied in real clinical setting through patient assessment, diagnostic investigations, medical treatment, and the last one is comprehensive nursing management. So let's start from the scenario overview. So this case involved a 35-year-old man from a rural area in Nepal. So initially, the patient only experienced a mouth cough. However, due to the limited healthcare access and lack of awareness, he delayed seeking for professional treatment. Instead, he practiced self-medications using over-counters of antibiotics and traditional remedies. So over time, his condition became progressively worse. So the patient developed persistent productive cough, progressive weight loss, low-grade fever, night sweats, and generalized weakness. So this scenario reflects a major public health challenge in tuberculosis management, especially delayed diagnosis and poor treatment adherence. As a future healthcare professionals, that remind us that early intervention is extremely important in preventing complications and disease transmissions. Upon admission, a comprehensive clinical assessment was performed. Based on the patient's symptoms and histories, clinicians strongly suspected active pulmonary tuberculosis. The important clinical indicators include the first one, which is chronic cough lasting more than 2 to 3 weeks. Second, which is the constitutional symptoms as fever and weight loss. And the last one, which is prolonged untreated illness. Additionally, this patient history is incomplete. Antibiotic use raised concern for possible drugs resistance. So therefore, the provisional diagnosis established was active pulmonary tuberculosis with potential risk of drug resistance. So the diagnosis was guided by screening recommendation from the Centers for Disease Control and Preventions. To confirm the diagnosis, several laboratory and diagnostic investigations were carried out. First, which is the sputum samples were collected for acid-fast bacilli smell microscopy. And the result was positive, indicating active tuberculosis infection. So for the next test is about molecular diagnostic testing using expert MTB or RIF was performed. This test is highly important because it can rapidly detect the Mycobacterium tuberculosis, which is the bacteria that causes tuberculosis, and also identify the rifampicin resistance within a few hours, which is efficient enough. Additionally, these investigations include the chest X-ray and also the blood test itself. So for the chest X-ray revealed that lungs infiltrates and also the possible cavitary lesions, which is indicate tuberculosis. Meanwhile, for the blood test itself, we're going to show evidence of infections and poor nutritional status, for example, the raised level of leukocyte in our blood test. Overall, these findings are confirmed the active pulmonary tuberculosis and also emphasize the importance of rapid and accurate diagnosis. So after confirming the diagnosis itself, the patient was started on the standard first-line anti-tuberculosis therapy. The treatment regimen consisted for 4 medications. The first one, which is the isoniazid, the second one, which is the rifampicin, third one is pyrazinamide, and the last one, which is ethambutol. Treatment was divided into 2 phases. So the first phase is called intensive phase, so lasting for 2 months, which aims of rapidly eliminate the actively multiplying bacteria in our lungs. This is followed by the continuation phase for approximately 4 to 6 months to eradicate the remaining bacteria and prevent for relapse. Combination of this therapy is essential because it helps to first prevent the drug resistance. Next is to ensure complete eradication of infections and to reduce the transmissions within the community. So this treatment approach follows the international guidelines from the World Health Organization, or also known as the WHO, and the CDC as well. So let's come to nursing management, or also known as the nursing responsibilities on playing the role to treat tuberculosis. So besides medical treatment, nursing management play a major role in the patient's recovery phases. So one of the most important interventions was the implementation of direct observed therapy, also known as DOT. So under DOT, healthcare providers monitor the patient while taking medication to ensure full compliance. This is important because poor adherence may lead to multi-drug resistance of tuberculosis. Nurses also closely monitor the adverse drugs reactions. For example, isoniazids and also the rifampicin may cause the hepatotoxicity, and while ethambutol may cause the visual disturbance. Early detection of these complications ensure patient safety and also improve the treatment outcomes as well. Other than nurses have to monitor the patient's reaction on the drugs itself, basically nurses have to control the transmission of infection as well. So infection controls measures were also implemented to reduce the disease transmission. The patient was placed under the airborne precautions, which included patient isolation, use of face masks, and also ensuring the proper ventilation. Next up is about patient education. As a nurse, we always play the role of educator and advocator as well. So we have the knowledge to educate patient on completing the full course of treatment for tuberculosis. Next one is to avoiding the self-medication. Next, which is maintaining the proper nutrition and hydration. And last one, which is how to prevent TB transmission to others. Education is essential because it improves the treatment adherence and also reduce the relapse risk. This demonstrates how basically nurses play a critical role, not just only in physical care, but also in health promotion and disease prevention itself. So next one is about the nutrition and psychological or psychosocial support. Alright, tuberculosis does not only affect physical health, but also emotional and psychological well-being. Therefore, holistic care was provided to the patient. So let's start from the nutritional support included. So nutritions are important to our body to make sure our body stay healthy and stronger immune system. So the nutritional support included for the TB patients are high protein diet, high calorie intakes, and also the adequate hydrations. These interventions will help to strengthen the immune system and promote recovery. Psychosocial support was also important because tuberculosis patients often do experience fear, stigma, and also social isolations. Providing the emotional support and involving the family members are truly help to improve the patient's motivation and also the treatment compliance. This highlights the importance of patient-centered nursing care. Based on the whole scenario here, we would like to discuss about the patient outcomes. So following the appropriate treatment and comprehensive nursing care, the patient shows significant improvement. Clinically, the patient experienced reduced cough, resolution of fever and also night sweat, gradual weight gain, and also improve the energy level. Laboratory findings also improved significantly. The sputum smear converted from the positive to negative, indicating that the reduction of bacterial load and successful treatment response. Overall, the patient recovered without the immediate complications. This case clearly demonstrates that early diagnosis, standardized treatment, and a strong adherence support are essential for successful tuberculosis management. In conclusion, the management of tuberculosis extends far beyond simply giving the antibiotics. Successful tuberculosis treatment requires a rapid and accurate diagnosis, evidence-based pharmacological therapy, continuous monitoring, and also a holistic nursing management. This case also highlights the importance of patient adherence, nutritional support, infection control, and psychosocial care in achieving the successful outcomes. From a nursing perspective, nurses are the frontline healthcare providers responsible for implementing the direct observed therapy, DOT, monitoring side effects, educating patients, and preventing the disease transmission. Ultimately, comprehensive tuberculosis management not only improves the individual recovery, but also helps to reduce the community transmission and supports the global and tuberculosis goals established by the World Health Organization. That's all from us. Thank you so much for listening our presentation.